Welcome back to TV5 News at 9. It's time now for Medical Moments with Covenant Healthcare. Joining us this morning is Chief Medical Officer Dr. Michael Sullivan. Dr. Sullivan, thank you so much for joining us today.
Thanks for having me, Colette.
You are welcome. Okay, so we know it's really been a tough and a scary time over at Covenant, and you're working really hard to make sure patients are safe. What are you doing at Covenant?
Yeah, it's been a scary time for everybody for the past several months. At Covenant, patients are our top priority, so we've always put patient safety first. Obviously, over the past several months as this pandemic has become real in our community, we've had to take extra steps to meet that need, to meet the need of putting our patients first. Things like having hand hygiene stations at every entrance to our facility. Things like doing wellness checks for everybody who comes into the institution. That includes employees, visitors, patients. Things like extra cleaning in different rooms. We've taken different areas of our hospital and committed that to certain patient populations. We've changed our staffing concerns to address those needs as well. The use of appropriate personal protection equipment. We've tried to minimize the traffic through our institution. Again, using all of the social distancing guidelines that I think have become pretty much the norm in our community.
Well, you seem like you're definitely doing a lot, Dr. Sullivan. Also, now for people who are coming in for surgery, they need surgery, what are you doing just to ensure that they're clean, everything's clean, and everything's safe at Covenant for those patients?
Sure. So ever since March, when the governor put her executive order out that we had to postpone any non-essential surgeries, we've always been here for patients who needed care. We've always been here for patients who needed emergent care. We've always been here for patients that needed essential, time-sensitive care. Obviously, as this time has progressed, people have become more sick, and people need to have procedures done. They need to have surgeries done. So as we do that, we've also instituted additional measures to, again, put our patients and our staff safety first. Things like extra cleaning in the operating rooms. We're taking longer between procedures to make sure that we're doing a deep clean of our operating rooms. We're using appropriate intraoperative, meaning during surgery, steps, use of special masks, use of special gowns and gloves for patients. Again, we're also trying to minimize the traffic for our patients that come in for procedures to minimize their exposure to other people as well. We've also got set up certain screening and testing protocols to, again, ensure that we're not bringing any unnecessary things into our institution.
And that's why it's very clear to us why Covenant just recently received its 4th A rating for high-quality, safe care. That is awesome. Tell us about that great honor.
Yeah, again, so patient safety is really why we're here. It's our top priority. So Leapfrog is a national consortium that looks at over 28 publicly reported patient safety data points, metrics out there, outcomes. Also looks at the practices and policies that you have as an institution, and then gives a letter score around that, which essentially gives you what is the focus that your hospital is putting on patient safety. So for 4 cycles in a row, we've been able to achieve an A. It's a wonderful validation for all of our staff and employees to know that the things that we're doing are really being recognized. It's also a wonderful thing for our community to hopefully give them confidence in us to know that we are doing the right things, especially at this time. There's a lot of fear. People are scared out there to come to the hospital. And hopefully this is another additional piece that they can say, hey, Covenant really is trying to do the right things.
And that goes into my next question, Dr. Sullivan. With all that's been going on, if people need urgent medical care, what should they do?
Yeah, if I can just hopefully tell people one thing this morning, please don't neglect coming to the hospital. If you have an emergency, please come to the hospital. If you have a medical issue that needs to be addressed, please come to the hospital. Please seek out the care of your physician. We're here, we're open, we're here, we want to take care of you. And Covenant, as we've said here this morning, we're doing everything we can to keep you safe. And so please, the last thing that we want is for people to sit at home and not come to the hospital because they're afraid.
Well, we have to say congratulations first for your A rating. That's awesome. And thank you for spending time with us. We know you're a very, very, very busy man. We appreciate your time today.
And just a quick thing.
Yeah,
I want to thank the community for supporting us doing all of this. I want to thank all of our employees and staff and physicians on our staff for the tremendous work that they've done during this pandemic. This really does take a village to get us through this. And I think we're hopefully starting to get over the hump and to start to see where this is all going to go. So thank you for having me this morning, and thank you to everybody.
And we are so lucky to have Covenant right here in mid-Michigan. We appreciate you. Thank you so much, Dr. Sullivan.
Thank you.
You're welcome. And if you'd like any additional information on today's topic, just head on over to the Hot Links page on WNEM.com.